Welcome to Section 3 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program inspired course for non-specialists.
In the last section, we explored how to offer care with compassion, respect, and cultural sensitivity, from communication skills and human rights protection to the biopsychosocial spiritual approach. Now we begin focusing on specific mental health conditions, starting with one of the most common and widely misunderstood, depression. In this video, we'll look at the causes and risk factors for depression, what makes someone more likely to experience it, and how these factors interact with personal, social, and environmental circumstances. What is depression? Depression is more than sadness or feeling down. It is a medical condition that affects how people feel, think, and act. It can cause deep emotional pain, affect daily functioning, and if left untreated, lead to serious consequences, including suicide. But what causes it? The truth is, there's no single cause. Depression is the result of a complex mix of biological, psychological, social, and environmental factors. Let's break these down. 1. Biological factors. Some people are genetically more vulnerable to depression. If there's a family history of mental health conditions, the risk may be higher. Brain chemistry also plays a role. Imbalances in neurotransmitters like serotonin and dopamine can affect mood regulation. Certain medical conditions, such as chronic pain, stroke, or thyroid problems, can also contribute to depression. 2. Psychological factors. People with low self-esteem, poor coping skills, or a history of childhood trauma or abuse may be more likely to develop depression. Long-term stress, unresolved grief, or internalized guilt can also increase vulnerability. Sometimes, it's not just what happens to someone, but how they process it emotionally that deepens the risk. 3. Social and environmental factors. This is where context matters most, especially in low and middle-income countries. People who are living in poverty, facing unemployment, displaced by conflict or natural disasters, experiencing domestic violence or discrimination, caring for someone with a chronic illness, are all at higher risk of developing depression. And in many communities, gender-based violence, child marriage, or isolation, especially for women and girls, add further layers of risk. Let's not forget that substance use, such as alcohol or drug misuse, can both cause and worsen depression. Let's pause here for reflection. Think of someone in your community who may be at risk of depression, not because of weakness, but because of what they've been through. What factors, biological, psychological, or social, might be affecting them? Understanding risk helps us respond with empathy, not judgment. A case example. Blessing is a 28-year-old mother living in a rural town in Ocean State. After losing her husband to a road accident, she became withdrawn, stopped eating regularly, and often says, "There's no point in trying anymore." When her sister tries to cheer her up, she says, "You just need to pray harder." But a trained health volunteer recognizes the signs of depression and gently asks about Blessing's sleep, energy levels, and mood. With care and patience, Blessing is referred to a nearby clinic offering MH gap-informed care. Her healing begins not with medicine alone, but with understanding. In summary, depression is not caused by one thing. It often results from a combination of biological factors like genetics and brain chemistry, psychological factors like trauma, grief, or negative thinking, social and environmental pressures like poverty, violence, or isolation. By understanding these risk factors, we move from blame to support. We begin to see depression not as a personal failure, but as a response to real pain. In our next video, we'll explore how depression affects someone's daily life, from their energy and relationships to their work, parenting, and sense of self. But before we continue, here's one last reflection. Which risk factors for depression are most common in your community? And what can you do to reduce those risks through care, connection, or advocacy? Let's move forward with that question in mind.